Good morning. Is this Mrs. Taborton?
Yes, this is Mrs. Taborton.
Hi, my name is Alina Sibley. I'm a nurse practitioner and I'm calling from Rosewood Nursing Home.
Thanks for calling, Alina. I've been trying to reach somebody over there for a few days. I got a call from one of the nurses and she told me Mom screened positive, but I haven't been able to reach anybody since. This is so frustrating. Is she okay?
She's doing okay. She's well. I'm really sorry to hear that you had so much trouble. It's been a really difficult time and we're really trying to do our best to reach out to families. So I'm really glad that I reached out to you today. I wanted to talk to you about what this might mean for her and what lies ahead. Is that okay?
Okay, but I do wish my brothers could be here for this call, but I guess it's just not possible right now.
Well, I'm glad I can at least have the discussion with you as you're her healthcare proxy, and maybe you can relay this information to them afterwards.
Oh, sure, thank you.
Yeah. Can you tell me what your understanding is of this virus and how it's affecting people, first of all?
Sure. I've heard it mostly affects older people and those who have heart and lung conditions, and that many people are dying. That's what has me worried.
You're right, it does. Some people do get a mild form of the disease, and I really hope that that's the case for your mother. I'm just worried given not only her age, but also the fact that she has dementia. That if we were to attempt, any kind of resuscitation or transferring her to the hospital, if she's transferred to the hospital, she would have to be likely put on breathing machines. And chances are she would not make it, even on those breathing machines. She would also likely get very confused in the hospital because of her dementia. So I'm sure this is very hard for you to hear.
Yeah, wow. I wasn't expecting to hear that.
Yeah. Did your mother ever discuss with you what her wishes would be should her health decline?
Not really. I mean, she mentioned not wanting to go the way my uncle went.
Can you tell me more about that?
Well, he was on machines for a long time, and the family had a hard time deciding when to take him off.
Yeah, these situations can be extremely difficult. Some people see it almost as prolonging death instead of prolonging life. And we want to make sure this doesn't happen with your mother. It sounds like she would want to avoid that. And if you guys decide you don't want her, for her to go through that, and you'd rather she not be transferred to the hospital to have all that done, then we could keep her here comfortably with comfort measures so she could die peacefully here. I suspect this may be incredibly hard for you to hear. How do you feel about this?
I feel overwhelmed. Really sad.
Yeah.
I don't want to give up on her, and that's what I feel like I would be doing.
I can't imagine how difficult this is. And it sounds like you and your mother were really close. And I really wish things were different. I know you want the best for her. And it sounds like you're wanting to provide compassionate care for her during this time and avoid care she would not have wanted.
Yes, of course.
So just to kind of review what we've talked about, again, what I hear you say is that if her health were to decline, your mother would not want to go through resuscitation or be put on machines like your uncle was, but to die more of a natural death, supported comfortably here at Rosewood. Did I get that right?
Yes, I think that's true. She wouldn't want to be on machines like my uncle was. Can I discuss this with my brothers and perhaps we can talk again tomorrow? I'm pretty sure we'll all be on the same page. I just want to be sure about this.
Absolutely. We're here to support you and your family during this time. Based on what you decide with your brothers, we can update the advance directive she has here, the MOLST form, on our next call. I think that would be important. How else can we support you here? Can we involve the social worker or chaplain we have here?
I'm not sure yet. Let me start by talking to my brothers and I'll let you know. Okay?
Sure, absolutely. Thank you so much for sharing this information with me, and we'll talk soon.
Okay. Thank you.
Okay.
Bye-bye.
Bye-bye.